So my name's Lana, I'm a physician associate. I have a biomedical science undergraduate degree, which was a 3-year degree, and then I went on to do a 2-year master's degree in physician associate. I now have a new role in a GP practice, a much larger practice. So I support the GP practice by seeing minor patients and complex patients. I also help with the admin workload, so that's action in bloods and hospital letters. I also have a role in GP out of hours where I help see the 111 triage and the A&E deflections as well. Yep, so the way supervision has worked for me, when I just started off as a PA at my first GP practice, I'd allocated time with my supervisor to see patients or to go through certain cases. But as time went on and I became more experienced, I went to my supervisor only when I needed to, or for prescriptions on the day. My old practice, we actually had a huddle midday where we went for trivial queries, and that was quite nice because we got the opinion of different supervisors as well. I think what's worked well for me is my first practice where I worked at Bolton Medical Centre. I had more time with my supervisor, I had longer appointments, closer supervision and support with my supervisor, and that was very educational for me. I got taught a lot and it actually helped me pass my national exam. And at the start, what I would do if I was concerned about a patient or I wasn't quite sure, I would then ask my supervisor to come and see that patient with me, and then we would go through it and discuss it. And I think over time, as, like I said, I became more experienced and more knowledgeable, it was only when I needed to see that supervisor. And I also got taught how to do the lab reports and hospital letters at my first practice as well, so that was very helpful as well. I think what hasn't worked well for me so far is sort of the prescribing delay. So as PAs don't prescribe at the moment, it was quite difficult to not have a prescription right there and then for the patient, because I think patients are very used to having a prescription handed to them or be sent to the pharmacy after their appointments, and I think what they didn't understand, it didn't work like that with a PA, and it was just a bit of a challenge adapting to new supervisors and their techniques. So some supervisors would prefer to do the prescription maybe at the end of the clinic, some are happy to do it during your clinic, so that was the challenge really. Just have an open door policy. Please be mindful that, you know, physician associates have only done 2 years of university, and they will have challenges, so please let them ask away, discuss with them. No question is stupid. Please don't be judgmental of the PA, and see patients with the physician associate if they need you to be there, and just be aware of the PA role and what the strengths and weaknesses of that certain PA is, because I think that's something really important.